So today's June 1st. I went in for my cardio appointment with it wasn't the surgeon who did the catheter and the stents, but it was his assistant, the nurse that works with him. And honestly thought I got a good report basically from the cardio rehab people, and I took my blood work and all that, and, blood pressure numbers and all that to them, and she thought that was good. My progress seems to be good so far. One of the big things they wanted to check in with me and see how I'm doing with the medicines, and another thing is they wanted to see how do I feel, kind of see me in person, talk about what's the next step and stuff like that. One of the issues that we wanted to check up on was the refraction rate of my heart, because the last time they checked it was like a 45% output, and it's supposed to be closer to 65, I think was the number. But I did the echocardiogram today to see if that has improved, and I have yet to get back the results, but I feel like it has. And I know that's stupid, because I wasn't even feeling like I was going to have a heart attack, and I did. Which kind of tells you the whole. Sometimes you're I found out that one of the people that I support, I'm in IT at a hospital, and there's people that I go to their clinics and stuff, and I support them. One of the ladies that I support died last Friday, recently, almost a week ago, Friday, yeah. So she died from had pneumonia, lungs were really bad, 59 years old. But her coworker that told me, it's probably a violation of HIPAA, by the way. I don't know, rumors. But the coworker said that she was known to be a big smoker and wasn't going to stop, just non-stop smoking all the time, which is terrible, because I've got family members my mom basically died from the same thing. She had lung issues forever and wouldn't stop smoking, and I mean, up until the day she died, she was coughing and smoking, and it killed her. So I'm not saying smoking alone kills you, but she made a lot of decisions that were bad, and I love her, to death. I'll love her forever. I know my mind's all over the place, but I can't help it. Plus, I keep hearing, I've got the earbuds in, and I keep hearing these vehicles show up, and my thoughts are all over the place, because I am trying to keep focus, and I had to splice the video. That white car, that's my wife. I had to splice the video together because she pulled up alongside of me. She's headed home in our neighborhood, and she saw me, so she decided to pull up and started yelling at me, and I had to stop recording so that I could say hi to her. And she said, "I just wanted to see how you doing and tell you I love you." But she's sweet. I mean, I probably wouldn't be here right now if it wasn't for her. But what topic was I talking about? My mom did all the bad stuff, wasn't willing to change. It did not help her health in any way, shape, or form. I'm trying to do everything I can to help mine. So let me get back to the topic of cholesterol in the medicine, the statins. So we got to that point, and we were talking about statins, and she said, "Well, I hear that you quit taking your statins," because the one nurse that interviews me before I go to see, it's like levels of important people. So when I first walk through the door, it's just the greeter, and then I talk to the nurse, who's basically like, "I'm just going to take down your information," and then she relays that to the next girl, who was the final girl for me, and she wasn't the doctor, the surgeon. I mean, she may be a doctor, but she wasn't the surgeon who did all the stuff. She's kind of his next level. And so she asked me about the statin, and I said, yeah, I had started having a ton of bad effects. And she said, "What bad effects?" And I said, "Well, I've got a whole list, and maybe I'll take a pic. In fact, I will. I'll take a picture and add it, because I've got to edit this video anyways, since my wife came in and kind of interrupted the video. It'll be more than one. I'll have to split it together. I'm gonna put a picture in of the exact side effects that I told her I was having from the statin. statin, that she said, well, I've got tons of people who have issues and can't take them. She said, there's other stuff we can try, a different statin. We can step the statin percentage down. And honestly, to tell you the truth, I think that's awesome that she was willing to acknowledge that for me it's an issue, and was willing to back down the percentages and all that. But I'm just not willing to do a statin in any way, shape, or form, because I think that it's something, when you globally shut down your body's ability to make cholesterol, I think it's bad. Because, you know, if you need to make testosterone or estrogen or any of the sterols, cholesterol is, you can't make it. And if you do make it, it's in trace amounts. Your cholesterol is used to heal tissues of your body, specifically your soft tissues more so than others. It's hard on your liver. It makes your liver release enzymes because it's under duress. And these things all lead to just problems, man. So I know there's people who need them. And if I were unwilling and just absolutely going to be someone who's not going to change their lifestyle and their diet, if I was essentially going to be like, well, bro, I'm not going to give up my pizza or, you know, my cheese or whatever it is, then I'd have to take a step. I'd be like, well, it's either that or die, right? So that's when you make the decision to continue to do the things that were causing you harm, or you have to take the medicines they want to give you so that you can prevent it from doing your body damage, which in and of itself, then the medicines do damage. It's just a sucky cycle that sometimes we have to be a part of. But in my opinion, I think that I would rather do the things that are better for your body and not take the medicines and kind of adhere to those. Be as strict as you can. You know, nobody's perfect. And see if you can improve it that way. And if I do, if I go through this process and find that I can't lower, you know, my numbers or improve my situation, I'll be likely to be compliant. But I told the girl that I said, well, before I say yes to a lower dose, and before I say yes to an alternative statin, let me try to do lifestyle change. Let's check the numbers. Let me try to do this. I told her, I said, do you have any patients that have changed to a whole food, plant-based, no oil kind of diet? And I've been cheating a little bit. I'm not doing it perfect, but I'm pretty good. I think I'm probably doing it 95%, maybe 92, if we're being honest. But I'm doing pretty good. My numbers probably have to look a little better right now. I'm not certain, obviously, but I'm thinking about having I told her that I would like a test, and she said, well, we don't usually test it this close. And I get that. I get that insurance don't just pay for whatever they ask for willy-nilly, and so they have to have justification. But I'd really like to know, how has a month essentially of eating like this and continuing to walk and drinking a lot of water, significantly reducing my coffee intake, has impacted my cholesterol levels. We'll see. If they won't test it, I'll end up paying for it in a third-party lab like I've done already. Boy, it's just getting louder and louder out here, isn't it? I think I'll pause here and resume in a minute. My finger issue seems to be getting better as well. I'm noticing problems with it less and less. I've started, massaging it more often. I put a little anti-inflammatory, not NSAID based, but just some anti-inflammatory cream on it to try to give it a boost in healing. Speaking in a boost in healing, they didn't talk to me about the fact that we're supposed to stop my aspirin at 30 days. And the reason why I went into that with a segue is because aspirin's an NSAID, a non-steroidal anti-inflammatory drug. NSAIDs inhibit healing. I know that this is true, you can Google this. But I remember specifically when I had my hand surgery, my knuckle surgery, I remember I was on meloxicam, and the surgeon was very concerned about that. And she said specifically because NSAIDs hinder soft tissue healing worse than the other stuff, I guess. And so I was like, well, I'm not going to take it then. I definitely want this knuckle to heal up. And so I know that this is true. And my hernia defect that's in the ventral hernia in the middle of my stomach, it's a soft tissue too. So, yeah, there's another lawnmower. I'll pause again for a minute. So I want to get off the aspirin for that reason and for another reason. Another reason is, as you guys know that follow the channel extensively, I'm a bariatric patient. I've had the vertical sleeve gastrectomy, and NSAIDs will cause us to have stomach ulcers. And stomach ulcer, for me, especially right now, can lead to internal bleeding. And with me taking the 3 blood thinners that I'm on, if I haven't said it before, it's aspirin, it's a blood thinner. There's Eliquis, which I think is the anticoagulant or antiplatelet, and then Plavix. I can hear that wind. I know it's up pretty high right now. Either way, all 3 of those things help to reduce blood clot. You can't get a break today, man. Everybody and their mom's outside enjoying the weather, and people are doing their lawn, and kids are playing. There's people playing softball back here. I don't know if you can see that back there. A team of people playing softball. Planes flying overhead. I guarantee you this is probably going to be the noisiest, crappiest video, you guys. Maybe I'll turn subtitles on this video and let you guys just mute me. But I want to get off the aspirin so that I'm not on the NSAID, because it's bad for gastric patients like myself, and I don't need internal bleeding. Could lead to a major problem for me having these blood thinners. So I mentioned that. It's funny because when I was talking to the girl, she said, this is the surgeon's assistant, she said, yeah, we're thinking we're going to drop one of them, but typically for a stent patient, you're going to have aspirin and Plavix for 6 months to a year. And she said in the metoprolol, which is the beta blocker, she said in that 6 months to a year, it could be 2. And I said, well, 2 things you need to consider. A, look, I mean, why hadn't they done their homework? So I know they got 1 million patients and I'm not special, but I said, I don't know if you've seen it in the notes, but I'm a gastric patient, and NSAIDs are bad for me. So the doctor actually said he would drop the Bayer aspirin. It's only a children's aspirin, but still. He said we dropped that in a month, and we'd probably continue the Eliquis and Plavix, clopidogrel, for the remainder, for those 2. They're strong though. Eliquis is a strong anti-bleeding medicine, and you see this fever blister right here? I've had that thing for about, I don't know, 4 days now. It will not heal because it won't clot. Because if it does start to clot and scab, if I smile or make some food or do anything that moves my mouth, really, which is everything, it cracks and it'll start bleeding again. So literally it's that bad. It's risk of me bleeding is pretty high. So I'm going to come off of one of them. If they don't make the decision, I'll make the decision and tell them which one I dropped, which will be aspirin because it's an NSAID. But I mean, I'm not completely. Her question to me was when I talked about dropping the statin, which was Lipitor, atorvastatin. She said, "Sorry, are you anti-medicine?" Or it's funny because that seems like a pretty frank question. Are you anti-medicine or? And I said, well, I mean, not completely. I think medicine's important, useful, but I don't want to be over-medicated, and I don't want to be medicated when there's a natural alternative. So I would prefer natural alternative or lifestyle change. And then, like I said, give me the chance to see if I can do it. If I can't do it, and you've demonstrated to me clearly that I can't do it, I'm not an idiot. I know that I can't live with elevated cholesterol. A side note is a lot of doctors think cholesterol alone isn't the biggest issue anyways. And the things that I was doing bad, I can list the top 4 things that I was doing bad. It was vaping, that's probably number 1. My blood pressure has been 140/90 on average for like 15 years. Number 3, 4 to 6 eggs a day I was eating, with cheese most of the time, and cooked in butter most of the time. I don't know because I was getting it from the cafeteria. I'd say 4 of those were, 3 to 4 were like that, and the other 2 were usually boiled. And the 4th thing is I have poor genetics for sure. You know, my mother died from heart-related issues and blood-related issues, and everybody in my family, I don't have any elder family members that made it to 60. So literally my goal is to get to 60, and then I'll have 1. But it's kind of like I lost though, because if none of them make it to 60, you know, and I do, they're all dead. So it kind of sucks. But, you know, I've got kids and grandkids. I'm going to need to beat that curve and stick around. And my wife wants me to be here. So I'm going to do everything I can to improve those numbers. I'm still feeling really good, like better and better. So I have no doubt that I'll be able to turn these things around. Essentially, in a nutshell, I think that the visit with the doctor went good. I'll have some exact data soon. If I get it in the next day or 2 before I edit this video, I'll include it, maybe a picture or maybe even a note. Maybe I'll even just stick right here, some type of note that says I've improved my heart function. I think that I have, but we'll see. I know this is pretty long, man. This video alone 6 minutes, and it's about 8 segments of video here. So this will be my update for the day. You guys take care.